I can never get this thing right. I'm gonna go off video just while you guys are presenting.
Okay. We can go ahead and get started.
Okay, thank you. Hi, everyone. My name is Lori Keel, and I'm Manager of Field Development for Autism Speaks here in Washington State. I'm based in Seattle. I am your local staff person, so if we've never met before, I would love to change that. My contact information will be included in a follow-up email, so I hope you'll reach out. I would love to connect. Before we get started with today's topic, I do want to take a moment to acknowledge the important and difficult national conversation happening now about systemic racism and inequality fueled by nationwide protests over the death of George Floyd and others. Autism Speaks has issued the following statement. Racism and discrimination have no place in our society. Deeply ingrained in the Autism Speaks mission is a commitment to creating a more equitable world for those we serve. The autism community is diverse and broad, including all races, ethnicities, abilities, socioeconomic groups, belief systems, and identities. We stand with our volunteers, our colleagues, our partners, and every member of our community in speaking out against racism and speaking up for a world that's more inclusive and empathetic, where all people are respected, protected, and valued. And now that you know where we stand, I'd love to tell you about our mission, which is to promote solutions across the spectrum and throughout the lifespan for the needs of people with autism and their families. We do this through advocacy and support by focusing on 5 key mission objectives. Those are increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs in the areas of causes and better interventions for autism and related conditions, increasing early childhood screening and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. And with that basic information under our belt, it's now my pleasure to introduce you to Judith Ursetti, Autism Speaks Director of State Government Affairs. Judith?
Hi, everybody. Thank you so much for joining us on a Friday. I know everyone's probably Zoom weary, and it's definitely been such an emotional time, a challenging time. So hopefully today we can provide some helpful information about what's going on the federal level that affects the autism community, things that are happening on the state level too. And then we also have information about community services that are available during the time of COVID-19. You'll notice that you're muted probably and your video's not on, just to save bandwidth because of the number of participants that we have. You can communicate with us though through the chat box, and I encourage you, please do that. We want this to be interactive. We want to hear from you, hear what you need. And speaking of what you need, we have been hearing from our community over the years, and particularly over the last few weeks and months as we weather the pandemic that has decimated supports and services and the way of life for so many in our community. So we've definitely heard about the just rug being pulled out from under people who are trying to access educational services, which sometimes we spend a lot of time talking about how awful our educational services can be in the autism community, and those conversations are valid. But when they completely go away, that's a whole other situation. And the remote learning situation has been so challenging for many in our community. We're hearing from all of you, from self-advocates, from parents, from the providers who are trying to do what they can. It's so hard. The same goes for the invaluable day programs that are out there for people who are trying to be in the community and be part of day programming, the clinics that serve our community, and that shift to telehealth. For some, that's been amazing and helpful. For others, it's been really challenging. And then of course, providers are trying to weather this storm economically too. And we need them to do that so that they're available to serve our community moving forward. Mental health supports are so critical for autistic individuals, for their siblings, for their providers, for their parents. I'm the parent of a 16-year-old son, Jack, who is an incredible human being in person, and I've learned so much from him. He has a severe intellectual disability. He suffers from OCD. So he has a lot of things that are difficult to carry, and he's got a great sense of humor, and he's got beautiful blue eyes, and he's a fantastic runner. He runs on our cross-country team at our local high school. So like all of us, he has strengths and he has challenges. As his mom, through the years, I've needed to access mental health supports for myself in order to be able to support him and the person that he is. And so if you're a parent, if you're a sibling, if you're a provider, if you're someone with autism, don't worry about the stigma. Reach out and try to access mental health supports. All that said, right now it is a little challenging to do so, and hopefully the telehealth piece helps fill that gap. There's a lack of connection right now for all of us, but for many in the autism community, kind of isolation might be a little bit of a relief and help reduce some anxiety. For others, we're hearing that it's really increasing anxiety. Again, I'll point to Jack, and I promise not to do this the whole time, but he definitely has a routine. Part of his routine is every Saturday we go to Outback Steakhouse for wings, and he has developed friendships there with the staff. They know exactly what he needs and what he wants, and those connections mean so much to the staff, to Jack, and that's gone right now. We do pick up food there to keep the business open, try to support them, but that regular connection, which is one that has been established for over 10 years, going every Saturday to Outback, it's not there. And so that may sound trivial, but I know there are things like that in the community we're hearing that are just missed. Going to church, going to school, going to the park, things like that that are not happening or have not been happening. Supportive community employment, those opportunities are limited right now. Respite for families is so important to avoid and to avoid challenging behaviors and to help provide relief when needed for the entire family. Disruption of routines, as we've mentioned. The staggering income loss that's occurred. Our life is expensive, it's hard, and to lose income is just too much. Challenging behaviors, we're hearing so much through our autism response team and in these state webinars as we talk to people about challenging behaviors. It's hard for people with autism. Those behaviors can cause aggressions towards others, they can cause self-injurious behaviors, and that is very difficult, especially when there's not that many places to go for support and relief. And then, of course, trying to access healthcare and make sure, for instance, if you're a person who has autism and you're hospitalized, who can be with you to provide support during that time. It's challenging right now. So those are the themes that we're hearing as we interact with the community. And so those are the themes that have truly informed our federal and state advocacy. And if you have other themes that need to be added to that list, we want to know what they are. We want our advocacy to be representative and meaningful. If you have something that's really compelling and you need an answer that's really individualized right now, please know we have an autism response team that's here for you. We're going to talk a little bit more about them later, but there's a phone number you can call. That we have a phone number to serve those who are Spanish speaking. And you can always email to help@autismspeaks.org. Or if you go to autismspeaks.org, there's a chat box that pops up where you can interact with someone from the autism response team there. So we want to help, so just know that we're here. Okay, so you've probably heard enough from me for right now. Forgive me for going on. And thank you, Lori, for the warm introduction. It's so good to have you in Seattle and on the ground serving the community. David Sikoski is going to provide a federal update momentarily. I'm going to talk with you a little bit about what's going on the state level. And then Ann Sullivan, who's an amazing human being, is going to provide information about supports and services and community outreach. So without further ado, I want to turn it over to Dave. Dave, if you could share with us what's been happening in DC and what might be happening moving forward, we would be so appreciative.
Thanks, Judith. I'm actually having trouble getting my video started. It says need to get it restarted by the host. Let's see. There we are. Hey, everybody. And thank you, Judith. It's great to be with you all this afternoon, and appreciate the opportunity to talk with you all today. So as Judith mentioned, my name is Dave Sikoski. I'm a Senior Director of Policy and Federal Government Affairs based out of our Washington, D.C. office. What I wanted to do today is go over on a high level what has happened in Washington, D.C. Since the outset of the COVID-19 pandemic in terms of bills that have passed and the specific items that we have been advocating on in Washington and where we see things potentially going forward. And so in covering all of this, I know I'm not going to cover every last detail. I wouldn't want to do that. We could spend hours on probably each or several of these bills. And so we welcome questions. There's a Q&A box that you can see and as well as the chat box. And so if there's something specific that you're curious about or had heard about that I didn't cover here, or if you have questions about any of our content here, please feel free to ask. So what I'll do first is go over some of what has passed in Congress. So beginning on March 6th, the first bill related to the COVID-19 pandemic passed, which was the Coronavirus Preparedness and Response Supplemental Appropriations Bill. And this was really the first bill that was passed that provided emergency funding for the public health response. This is right at the outset of the crisis in the United States. And this was passed, I think, with the knowledge being that more work was going to have to be done. It was just kind of like the opening round of funding. And you'll notice here that I've written next to each of these bills, COVID-1, COVID-2, COVID-3. While each of these large pieces of legislation have their own names, as we've put down here, they've been talked about in Washington. I should keep clarifying, Washington D.C., but also probably Washington State as well, as COVID-1, COVID-2, COVID-3, et cetera, just in relation to the order in which they passed. So the second bill, the Families First Coronavirus Response Act, passed on March 18th, and this contained a number of different items to respond specifically to individual and family needs. So for example, it provided emergency paid sick and paid family leave to many of those working at employers that have less than 500 employees. We have information from the Department of Labor in terms of question and answers regarding eligibility that we could send to anybody who's interested. It provided some tax credits, free COVID-19 testing where available. Of course, we know that there have been a lot of challenges on that front. Expanded food assistance and unemployment benefits. And then there was an increase in Medicaid funding that went along with that as well. So a number of important items that were contained in there. However, this, as Judith mentioned, this has been a crisis that is just unprecedented. And the next bill, the COVID-3 bill, also known as Coronavirus Aid, Relief, and Economic Security Act, is a bill that I'm sure you all have heard of. It's the large $2 trillion relief package that included a whole host of different items to respond to the pandemic. So the $1,200 stimulus checks per person, $500 for dependents under age 17, that was a part of this act. Increased unemployment benefits, so the $600 per week increase was included in this bill. Hundreds of billions of dollars for the public health response, a significant amount of funding for state and local governments, specifically for the response to COVID-19. The Paycheck Protection Program, which is a program to provide forgivable loans for small businesses to retain employees and keep their businesses going during the pandemic, was included in here. I'll talk about that a little bit more in a couple minutes. Billions of dollars for schools. This is both for higher ed and for elementary and secondary education. And later on in the presentation, Judith is going to go into this in a little more detail in terms of the breakdown and how that funding is allocated, what Autism Speaks is doing relative to advocacy in that space, and just talk more about what we're hearing in the community and the concerns in terms of what needs to happen for our community with reopening schools. And finally, extending the Money Follows the Person program through November. So an extremely important bill, of course, in terms of the amount of relief that was provided and some of the areas that it touched on. Judith, could you please, yep, there you go, thank you. So even with passage of that large bill, there was still a recognition that there was likely going to have to be additional action. And while there has been some disagreement, significant disagreement about what shape or form that should take, those negotiations are still ongoing. and there's a lot of work that's still being done and discussed right now. In the interim period, on April 24th, Congress passed a bill called the Paycheck Protection Program and Healthcare Enhancement Act. And that was to respond specifically to concerns related to the Paycheck Protection Program, that small business assistance program that I mentioned a minute ago. That the initial CARES bill contained $350 billion, and that money ran out very quickly because of the high demand from small businesses to access the program. And so there was a desire among some in Congress to replenish that fund quickly. And at the same time, there were other concerns related to hospitals and public health response and testing. And so the reason that this bill has been called COVID 3.5 is that it very narrowly addresses just those concerns. So replenishing the small business assistance program, and then, tens of billions of dollars for hospitals and testing, although I think there's still an acknowledgement by many that there's going to need to be additional funding provided in those areas going forward. But that was the last thing that passed into law since the CARES bill on March 27th. Can you go to the next slide, please? Thank you. So our advocacy priorities during this COVID crisis have really been in response to, as Judith mentioned, what we've been hearing from the community in terms of needs. And this isn't necessarily all inclusive of everything that we've heard about or have talked about with federal legislators and others, but I think it's a reflection of some of the top issues that we have been advocating on during the crisis, but really welcome any feedback that you all have, or any concerns that you don't see necessarily listed on here. So the first thing, additional funding for home and community-based services. Obviously, this pandemic has upset every aspect of people's lives, and being able to access home and community-based services is so essential. So with additional funding, there would be an ability to provide the PPE that's needed for those who are going into homes, for caregivers, for the individuals who are receiving the home and community-based services. As well as providing an ability for continuity in the workforce, who are, who we really are in great need of. And one of our priorities, additional funding is not, I think, ideal in the least for most students, and particularly for many students on the spectrum. This has really been so challenging. And so the idea here is that we want to ensure that during this time where schools are closed, or they're operating on a distance format, that students are receiving the as much as possible the comprehensive services that are available. And then going forward, looking ahead to the schools reopening, that school districts have the funding needed to be able to address the learning loss and regression that we know is occurring right now, and that there's going to be a lot of lost time to be made up for. So that's what we are describing here in terms of additional funding to meet those needs. Protecting the rights of students under the Individuals with Disabilities Education Act, IDEA, and other laws. Prior to March 27th, there had been some concern that there were proposals to roll back some of those protections that are the core protections provided by IDEA that have been so hard fought. We, along with other disability rights organizations, had weighed in to ask that that there not be any waiving of these rights, that there are flexibilities under IDEA that exist, that you don't need to roll back these core protections. And unfortunately, the law that passed, the CARES Act, did not contain any waivers. There are many in Congress that fought against this, including, I know Senator Murray from Washington State was one of the leaders in fighting back against any type of waivers. So what happened is the bill contained a requirement that the Secretary of Education issue a report saying whether or not more waivers were needed. April 27th, the report was issued. She indicated that no additional waivers would be required for the core protections of IDA. So while we view that, of course, as a positive development, we also know that there's so much more work to be done beyond just that that report. And so, we're going to continue to be vigilant on this in terms of both IDEA protections and for funding for the educational needs of students with autism. So, expanded access to telehealth services for healthcare needs and ensuring people have access to try to allow for a degree of continuity of care. Again, it's not the same in terms of especially therapy services and other services, doing it in a telehealth mechanism versus just in person. But to the extent that it's possible, we're trying to advocate to ensure individuals on the spectrum have what they need. Eligibility for the $500 economic impact payments for dependents over age 17. The economic impact payments is another name for the stimulus checks. There's been a lot of different ways to refer to them, but bottom line is, in the CARES Act, there was only an allowance for dependents under age 17 to be able to receive the $500 dependent check. And we know that leaves out so many within our community. And so we have joined with, again, with other organizations in trying to advocate for a reversal or retroactive payment to those families that have dependents over age 17. The next one, according caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies accorded to caregivers of children. So, earlier I referenced the Families First Coronavirus Response Act allowed for paid sick and family leave for a host of different categories of eligibility for many people across the country. One of the ways that you could be eligible is if you had or if you have a child whose school is closed or childcare center is closed. It would allow for eligibility, along with there are other categories like if you were impacted by COVID, et cetera. But what was less clear from the way the law was written was whether or not the caregivers of adults with disabilities whose regular source of care, day center, or just regular source of care, it was no longer available. And so we, along with many others, weighed in with the Department of Labor, and in interpreting the law, they decided to allow caregivers of adults with disabilities to be eligible, which we thought was a very positive development. And the next, I would say last but certainly not least, is preventing discrimination in treatment decisions and care allocation based on disability. The Department of Health and Human Services, Office of Civil Rights, released guidance to medical providers across the country, something that we applauded, and hope that there's continued vigilance, and we certainly stay very, very much apprised on this and continue to fight on this issue. And then we've also released statements related to ensuring PPE is provided to personal protective equipment provided to group home settings. And then most recently, we issued a statement related to ensuring that those individuals with disabilities who have to go into the hospital for COVID-related reasons or otherwise, frankly, are able to have a caregiver accompany them during their stay. We've heard some very tragic and really heartbreaking stories around this, and know there's a lot of concern amongst so many. And so that statement is available on our website as well. So I just want to mention that we work with a whole host of members of Congress and are in touch with many different members. I wanted to point out that Congressman Chris Smith and Mike Doyle, who are the co-chairs of the Congressional Autism Caucus, have sent letters to congressional leadership advocating for many of these priorities. The last letter had 40 members signed on the House side. So we've been grateful for their leadership and the leadership of many other members as well. Go to the next slide, please. Thank you. So what's next? As I mentioned before, there's been a lot of discussion about another infusion of dollars, both to individuals and families, to state and local governments, to impact a whole variety of other areas that were that have been affected by the pandemic. And those negotiations, frankly, are ongoing. On May 15th, the House of Representatives passed the HEROES Act, which was a $3 trillion relief bill. And some of the priorities that were included in that were a substantial increase in funding for home and community-based services, which is certainly positive, $100 billion for education, which was in addition to the $1 trillion for assistance to state and local governments. The issue related to dependents over 17 would be retroactively fixed, clarifying the eligibility for emergency paid sick and family leave for caregivers of adults with disabilities. And then there was $10 million included for developmental disabilities activities. So at this point, the HEROES Act, while it contains some of these very promising priorities that I specifically articulated right on the slide here, it is less clear in terms of what the path forward is. That was the HEROES Act I would describe as almost an opening salvo in the negotiations for the next big relief package. The Senate, and specifically Senator McConnell, who's the majority leader in the Senate, has indicated that they are not going to take up the HEROES Act as is. And so there's a continuing negotiation around what the scope and content of an additional bill will be. And we don't know, unfortunately, at this point, what will be in there, what the timeline is for passage. It's very much in flux at the moment. But what we will continue to do is continue to reach out to try to hear from you and others within the community and take your feedback back to legislators in Washington, D.C. So with that, I know I've rambled on for a while. I'm happy to take any questions that may have popped up.
No. All right. Go ahead, Kelly.
Just say no questions so far.
Okay, wonderful. All right, let's go ahead. Everybody, you can stop and stretch if you need to. So much information. Thank you, Dave. And then I'm going to talk briefly about what's going on the state level. We have federal government, and then we have activity that's going on in the states. And it's been extremely interesting to see how they're working together during this time of crisis. All right, so we've talked a lot about the challenges that are somewhat unique to our community during this time. And so we're trying to target our advocacy on the state level based on themes. And so one's around healthcare, the other is home and community-based services, often called waiver services or HCBS services. And then of course, just the crisis around special education and how it's being delivered to the autism community right now. Also early intervention, which is a precursor to the special ed system. So there is good news in the healthcare regime. For those of you who utilize Medicaid for your health insurance, for doctor's visits, for well care, for illness, there's a waiver that CMS has made available nationwide to states. It's an 1135 waiver if you really want to get geeky about the numbers. And it just basically allows for flexibility. So during the time of COVID-19, people can still access healthcare, maybe a little differently, but they still can access it. So there's a list here of ways that the flexibility is being provided. The first one mentions settings. Some of the home and community-based services can be provided in various settings. Conflict of interest requirements are being relaxed or changed a little bit. All of this is temporary during the time of pandemic. Signatures that are normally required aren't. There are other ways to execute documents. Requirements around provider participation, prior authorization requirements, screenings, things that are necessary usually to keep care moving forward. All those things have flexibilities now because of this waiver. And then there's also information or flexibility around evacuating facilities to provide services in alternative settings. It's so surreal that we're having these kind of conversations, but it's a flexibility that's very important. And Washington State, of course, has been hit incredibly hard. So these flexibilities even more so matter in a place like Washington State. There's also flexibility around fair hearing requests and timelines too. So if you really want to find out more, we're providing links in the presentation, and you can actually click through and read the waiver and find specific information about it. Telehealth is something that some of us had used before, and in Washington State, there had been legislation around telehealth in the previous months and years. But with the pandemic and all the implications requiring us to stay at home, more flexibility has been provided on the federal level and then also on the state level. So in Washington State, there's a policy for telehealth for the Medicaid plans, the Apple plans that are there that many of you access, and the Medicaid managed care plans. So that telehealth policy is available, and there's a link there for you if you have any issues with the delivery of telehealth. And then Governor Inslee on March 25th issued an executive order that said, you know, payers, the private health insurance folks that are state regulated, really needed to try to provide telehealth services, and they couldn't make it more expensive or harder for providers. They needed to pay the same rates. They shouldn't deny from an in-network provider for a medically necessary covered service due to an existing provider contract term that denies reimbursement for telemedicine. So they're saying provide telemedicine in this time where people can't get to the doctor's office, cover it in your health insurance plans, and don't pay less, pay what you would pay normally if it was provided in person. The governor's order requires that. So, and it can cover things that affect our community directly, things like behavioral health treatments, which some of our community really need, that can be prescribed by their licensed physician or psychologist. Therapeutic services, things like speech, OT, PT, and then of course psychological and psychiatric care, those mental health supports can be provided via telehealth during this time. We're also having conversations about whether or not these telehealth provisions should be made permanent. We think they should be, just because those flexibilities are important, but we don't want it to be something that payers in the future can use to try to dilute the important in-person services that are needed too. So just another tool in the toolbox, but not replacing in-person visits when they are critical. Okay, let's talk a little bit about waivers. So in your community, you have various waivers that serve people that have autism, and they're called home and community-based services. And when the pandemic hit the country, CMS, the federal Medicaid agency, came out and highlighted a tool that they have called Appendix K. And Appendix K allows waiver services to also be provided in a more flexible way. So we talked earlier about, you know, your Medicaid services that are more like doctor's visits, you know, the healthcare piece. The waiver services, you know, they pay for things like, you know, day services, respite, employment services, things like that that mean so much to our community. And there has been a lot of flexibility included because Washington State has applied for this Appendix K flexibility that CMS is offering. And I will say Washington State has done a really great job of accumulating this information and putting it on their website about what this means for people who use waiver services. So can their person-centered plans be changed? Can their services be provided in a different setting? How does that happen? And in most of these situations, yes, you know, there is an avenue to doing these things because of the flexibilities that are temporarily provided through Appendix K. So definitely look at these documents closely for those DDA, home and community-based services. And then if you click the link, there's the really nerdy document that CMS approved that gives you all the details. Okay, this is what we're hearing about so much right now from our families in Washington State and around the country. And that is just the disruption of special education services and the attempt of school systems and state education departments to provide instruction remotely, not only to general education students, but the vast majority of our students who are cared for through special education. And what we're hearing, I would say overwhelmingly, is that remote learning is not working for the autism community. There is a subset of folks who are thriving, who are moving quickly through materials, and remote learning is definitely beneficial for them. But for the most part, the feedback that we're getting from our community is that, you know, one-on-one instruction through a screen for just a few minutes in a day does not replace and actually is eroding progress that has taken place with our families who are trying very hard just to continue to learn during such a challenging time. The Washington Office of Superintendent of Public Instruction has put out information that so far does not provide a roadmap for our families to know when they're actually going to have some hope around receiving services that are so important to them. Things, you know, in addition to math and science, many of our students are nonverbal or, you know, they have intellectual disabilities or challenging behaviors, and their families are not equipped to provide the kind of instruction they need that's intensive to get through the day and to survive during this time. So I did include a link on this page that talks about what a free and appropriate public education looks like during the time of COVID school closures, according to Washington's Special Education Department. But some advocacy is definitely needed based on what we're hearing from our community. We do know that money has come down. David mentioned it earlier through the CARES Act, the COVID-3 Act, and in Washington State situation specifically, $213.6 million was allocated for K through 12, and that was allocated via formula to the school districts. And a portion of that does go towards special education, but not a lot. Post-secondary received $202 million. And then there's a pot of money for Governor Inslee, about $60 million. That's specific to education, but it's at his discretion. Excuse me a moment, sorry about this. That's funny. That's the first time I've gotten a call during a webinar. That's really funny. I apologize. Anyway, Governor Inslee has discretion over the $60 million. And so in addition to that pot of money, there likely will be need for more. And I know COVID-4 is looking towards, you know, trying to funnel more money towards education generally, but our population is being left behind based on what we're hearing from our families across Washington State. And there's no representation, there's no resolution in sight. And so the themes that we're hearing are first around hardware, software, communication devices, assistive technology, access to Wi-Fi. If you're going to be using remote learning, you have to have the tools to use it effectively. And so many of our families are disconnected. They don't have access. They have multiple children who might need access to these devices. Parents are working from home. The equipment is just not there. So that's an issue. For children who are under the age of 3 that are in early intervention, it's such a critical time. The research strongly indicates that early intervention changes the trajectory of a person's life. If it's provided in a meaningful way that's individualized and evidence-based for that child who has autism. And trying to replace meaningful early intervention with telemedicine or teleeducation has helped a little in just staying in touch, but it definitely, these families are paying a price for not receiving the services that are critical right now, as brains are malleable and trajectories can be changed for the positive. So there's a big concern around that, and there's a big concern around what's happening to those children who are actually turning 3 during this time and transitioning into special education out of early intervention. Usually there's a time where planning occurs, assessments occur, and those certainly can occur, remotely, but we're worried that they're not occurring appropriately, and we're hearing that families are not receiving meaningful early intervention services. So we're asking that children be allowed extra time in early intervention if they need it after the state is open and school buildings and early intervention is open to this, so that they can transition into special education with the services that they need and not just be pushed into it without the right transition services. We're hearing over and over again from families just about the lack of services, things that they need on their IEP, behavioral interventions and supports, speech therapy, occupational therapy, physical therapy that students receive as part of their IEP services, help with reading, social skills, emotional support. Those things have fallen by the wayside during this time, and it's taken a tremendous toll. There's a lot of conversation around ESY, if it's going to happen, if it's not. It's varying district by district. But outside of the ESY conversation, it's really important that these compensatory services just be provided, whether they're provided in June, or July. It doesn't matter if ESY is occurring or not. These services are compensatory and they need to occur as soon as possible. And so we're asking state leadership and the districts to really think about giving students with IEPs who have specific needs access to buildings if possible, in-person instruction as soon as it's safe and there's appropriate equipment and protocol in place, but as soon as it's safe and feasible, that in-person delivery is so critical. We're hearing from our families and from teachers too, for that matter. They're really hamstrung. They're not able to teach in an appropriate way because of the limitations that affect our special ed and our autism community right now with this remote learning delivery system. And then finally, with regard to special ed, those students that are aging out of special education, they're federally mandated to have transition services to help them move out of special education and into the adult world. And if they're aging out during this time, those services are not being provided, and we believe that they should be, even if the person does age out. If they need to come back and receive those individualized transition services, that needs to happen. And so if it's appropriate for the individual, if they need it. So that's the other thing that we're asking state education leadership, the governor, and others to consider just to address the basic needs of our community. I know there are so many other needs that are out there, but these are some of the themes that we've had emerge as we've interacted with all of you. So we've been throwing a lot of words at you, a lot of slides. I'm sorry about that. We wanted to share our concerns, the concerns we've heard from you, the advocacy in which we're engaging. And if you have questions, I'm happy to hear them now, or we can follow up later. I would encourage you to stay in touch with us. We'll be reaching out with webinars like this moving forward in the future, but you can certainly follow us on social media, on Facebook, on Twitter, on Instagram. If you're not a social media person, good for you. You can also stay in touch with us on our website at autismspeaks.org/advocacy. And if you go to that page, if you scroll down to the bottom, you can sign up for advocacy alerts from us and stay in touch that way. So I'm going to take a breath. I'm sorry for talking so much. I get really passionate about this stuff, but I'm happy to hear from you if there are questions.
No questions, Judith?
Okay, you can tell it's Friday. Everybody's like, oh my goodness, this is a lot of information. All right, well, we saved the best for last. Mary Ann is going to talk with us about resources that Autism Speaks has available for all of you. We want to do what we can to be there for you. So without further ado, Mary Ann, I'm going to turn it over to you.
Okay, you can advance to the next slide. Hi, everyone. My name is Ann Sullivan, and I've worked with Lori in Seattle for the last few years. You'll probably see us again very soon as we are able to kind of re-enter our norm. But I'm thrilled that you're here today. And I have to say, I feel like I sleep better at night because of the advocacy team. It is, and I don't want to be boasting about Autism Speaks, but I just have to say, that there's a specialized team in Washington or close to Washington working and fighting for our children makes such a difference. And you can just hear it in everything you're saying, Judith. And David, just about all the work that you're doing, and it does make a difference. It truly does. I know as a parent of a 28-year-old son who needs a great deal of support, I know the everyday, hiring staff and making sure his vocational program is working is also very important. But when you think of the big picture, the advocacy work that the team is doing for us is really going to support us down the road, if not tomorrow. So thank you. Thank you for that. Of course, along with advocacy, Autism Speaks has put together just a great myriad of information and resources for families, individuals with autism, and of course, educators, paraprofessionals, and others. Going back to the autism response team, that is a team that is well qualified and spread throughout the United States based on where you're living. The calls come in so that person has been trained on what the resources are in those local communities. Do not hesitate to call them. They will, if they don't pick up the phone, they will call you back as soon as they can. We have Autism Cares grants specifically to help families through this difficult time. If you're interested in an Autism Cares grant, it's a small grant, it's $250 per family, but you know what? It makes a difference. It can help you out with groceries or gas or car repair, whatever that is. We want to support families that truly do need that extra little piece. You can receive an Autism Cares grant application. It's very, obviously we make this really simple and easy for families to get through. Don't want to add any more burden. You can get that through the ART team, the Autism Response Team. So please go ahead. We've had lots of donations from very large corporations who want to support our families as well. So the funding is there. We have specialized COVID-19 pages that are on our website. This talks about general resources for lots of different subsets of people who are involved with people with autism. So certainly take a look there. There's that link on the bottom of that slide that you can, it'd be nice if maybe Kelly could put that into the chat box for us so that people can readily, access that information. Next. So I'm always impressed with this slide because it talks about our toolkits. On the left-hand side, you'll see toolkits, mostly talking about milestones that people with autism make, from early concerns to action, the 100-day toolkit, transition toolkit, and then of course, I think there's 3 or 4 toolkits in employment and adult housing. So tremendous amounts of supports. They're all free. They're on our website. I would highly recommend them. Again, as a parent, I've gone through that transition toolkit time and time again, and I have it in one of my shelves that I pull it out. It really gives you a great general overview of the kinds of things that we want to be focused on during those 14 to 22 and on ages that are so critical. On the right side, you see more healthcare professionals who have written toolkits for us, how to have a successful doctor visit, how to go to the dentist, how to do a phlebotomy. I mean, all those things that come up every day for parents and family and individuals. They're great. Again, they're free and available on our website. Next. Again, I want to talk a little bit about our generic resources. We have a resource guide that has many categories. You can go in, put your state and your zip code. Your resources will come up. If you know of a great resource that you want to add to the directory, please do so. There's some links that are very obvious when you get on that page as to how to add a resource. We also have a community events page. That will tell you about local events in your community, and it works both ways. If you have an event, you can certainly submit that event, and that will be available to all people who live within that zip code when they query. Next. And I guess, we can't say this enough. The autism response team is there. You can pick up the phone and call them, 888-288-4762. Or email, this was an older one, but it still works, Family Services, which is now help@autismspeaks.org. They're there standing by waiting for your calls. If you have questions, whatever question it is, it doesn't matter. They're there for you. Next. Oh, thank you. Those are the community resources. Appreciate being part of this, Judith. Again, Autism Speaks advocacy team really rocks.
Oh, thanks. And you too, Marianne. Thank you so much. And I just want to end by saying thank all of you for participating on a Friday. We hope this information is helpful. If you need additional information, please email us at advocacy@autismspeaks.org. We will be reaching out to you with materials. We have a recording of this. If you really want to go back and watch it again, please do. We'll also have a hard copy that we'll send to you, a link to the webinar so that you can access the links that are embedded in it and get more information. But again, just know that we care. We want our advocacy to be meaningful for our diverse community, and we're working every day to try to do that. So please stay in touch with us, and please take good care of yourselves. Stay safe and well. Thank you so much, everybody.
Thank you.
Thank you so much.
Thank you.
Bye, Lori.
Bye.